Hello everyone, my name is Dr. Jacobs. I'm a doctor of physical therapy and I'm an inventor of ASTR specialty. I'm also a cancer survivor and I used to suffer from chronic migraines, headache, pain and fatigue before I invented ASTR specialty. So Gus, tell me what's going on with your elbow, what happened?
Well, I believe that I just overused it. I have pain about this area here regarding, I like to play golf a lot and I noticed that. I just think I overused it and it's been hurting me for several months now, maybe close to a year now. But,
Close to a year. So how did you hurt yourself? Like just repetitive strain?
yeah, repetitive. I was competing in the police and fire games and I needed to practice, so I was hitting over 200 balls a day. And,
Wow.
and now the pain is there, so I need your help.
Yeah. So, what kind of treatment? It's almost a year. So, what kind of treatment you had this year?
I went to the doctor. I went to my regular doctor, and I saw him. They gave me, and ibuprofen, and told me to ice it, and just try to stay off of it. And I also got a cortisone shot on my elbow, and that didn't seem to help at all. So I got temporary relief, but I'm back to the same,
So, how much pain at worst from 0 to 10, and what kind of pain?
During the game or after a game, I probably about a 10, and it goes down through the days, the days after. But right now I'm about a 4 or 5.
Is that constant pain or comes and
Yes.
goes?
No, it hasn't left me even after the cortisone shot.
So you have a constant pain, 4 or 5,
Yeah.
and then when you golf or use your
Yeah.
arm, that's
Right, when I reuse my arm, or I go play a game of golf, it starts to hurt again, and then once again I go through the same process over and over. But right now, I haven't played for about 3 months, but the pain, like
So
you say,
3 months, but there is no relief even with the rest.
correct.
Okay.
Even with the rest, yes.
Where do you feel the pain exactly?
Started here, came across to the back of my right elbow,
Yeah.
and now the pain is right about here.
So it's a golf ball.
Yeah.
Okay. So 4 or 5, and if we want to aggravate it now, we're gonna actually we'll let you golf like next session. You
Okay.
bring your gears next time. So, but for now, we're just gonna do the treatment, and actually, I will try to stimulate your pain. So, how we can increase your pain level? You said it's constant 4 or 5. So, how we can increase it now?
I think if I do this type of motion, put pressure, resistance this way, turning on my arm.
Turning.
Sometimes we're lifting it up a little bit.
Okay.
Hurts me. For the most part, I just feel the.
So let's say resist it and tell me if that's okay.
Yeah, definitely.
How much pain from 0 to 10?
It goes from 3 or 4 to like
This
7.
is nothing.
Yeah.
You're very weak here.
Yeah.
Like this is not even 1 pound resistant.
Yeah.
Yeah.
Right there. I feel it.
How much?
I feel the pain right there. That's like a
0 to 10.
something pulling. Yeah, about a 7.
Okay.
Right there.
So everything should be pain free. Okay. We'll have you turn this way. You feel that scar tissue here? You feel this knot?
Yeah, it feels.
You can see my hand is actually rolling
Yeah.
over it. You see? That's a scar tissue. See? And tell me if that's painful. Is that painful here? In here?
No. A little bit right there. Yeah, a little bit right there.
You feel this knot here?
Yes.
Okay. And you have a scar tissue. Make sure this is not painful, okay? How does it feel?
I do feel pressure, but it doesn't.
Pressure is fine,
Yeah.
pain is not fine.
Right. Yeah,
Pain?
a little bit. Yeah.
Sorry. Okay. So that's okay. And what kind of pain do you experience there when you experience pain? Sharp, dull, aching?
It's funny you say that. I do have like the constant pain, but sometimes I have that sharp pain and like burning sensation sometimes. But I don't know where that comes from.
You feel like a stabbing pain
Yes.
inside?
Yes.
Okay.
Yes. Definitely.
Is that too much here? Or it's okay?
That's right. I can take it.
Make sure it's not painful, okay?
Right.
And you have more scar tissue here.
Well, that was
And then
that was kind of painful.
This one?
Yeah. Wow.
Oh, you feel all those knots. Okay, sorry. And another one here if you like. Too much?
That's all right.
When they give you a cortisone shot, they give it to you here or here?
Here.
So,
Somewhere on this side. Yeah.
inside and here, yeah?
Yeah. Back here
Okay.
somewhere.
Mhm.
I don't remember too well. I didn't want to look at the needle.
Oh, wow, yeah. Yeah, needles are not fun.
Not for me. I'd rather get shot.
Get it over with.
Get it over with. Yeah.
And don't inject me. Is it too much or something?
No, that was. It seems like this one was. This one, the one over here was the
This
worst.
one more sensitive?
Yeah.
In here, and this smaller actually than that one.
You don't give golf lessons?
I give training to, not the golf lessons, but I analyze how people perform and find the restrictions. The goal is actually to increase the range of motion and see,
Right.
like, analyze the motion to figure out why you're not having full swings or full force.
Yeah.
And we're gonna go over that actually, how to really swing better. So yeah, I see a lot of golfers that well, we have to work on the trunk a lot, or have to give them flexibility so you can have a really good momentum with
Right.
the swing. So if you don't have really good trunk flexibility, you're really
That's
limited
true.
how much you can. So yeah, we'll practice actually outside like next time. So sorry if difficult. To make sure you really have a good swing, not even just for your elbow, but I want to make sure everything is flexible. Because if you limited in your trunk, you're gonna compensate somewhere.
Right. Yeah.
And most of the time in here, because you want to apply more force instead of using your body momentum.
Yeah.
And that's, even though I'm seeing you for your elbow, but we're going to work on the entire system just to make sure, because that could be compensation. And could be, well, majority of the sports injuries occur from either not warming up enough or overtraining. And I will give you tips on both of them, how to decrease the risk of having injury because of those two reasons.
Definitely overtraining for me.
Overtraining.
In one short period, I mean.
So you want to really take a frequent break, you know. Is that too much what I'm doing?
No.
You can see the scar tissue and you feel the grinding, that's a scar tissue.
Yeah, I feel the grinding, definitely.
You feel the grinding and you see redness where the scar tissue, you see? It's just those spots
Wow.
that you had the scar tissue. Let's roll this up
Yeah.
a little bit.
I could see what you're saying there.
Yeah, so for the scar tissue, with ASTR tools, you can hear the sound and you can see, look here, the vibration, you know. So we actually can have really another, like a map with the color of the skin, where the location of the scar tissue. Is that too much?
No.
It's a little bit nuts. I'm not sure. this feel? I can give you some more. Make sure. You hear the grinding?
Yes.
And it's right in here, you feel that?
Yes, I do.
Look here. Look how it's literally jumping. See that?
Yeah.
So let's hold on golfing. We're gonna do it next time when you come here, okay? Just bring all your gears and we're gonna go outside in the parking lot. Get some balls. And you can hear. You feel it?
Yeah.
Look how tight and the scar tissue.
Wow.
It's actually, the tool is not really
Yeah.
going over it. So all of that gonna pull on your elbow, so you will not have a full swing, full range of motion, and you can feel, you see it like in your, it's more in your biceps here, so your biceps attached here, so you will not be able to have full length of your
Right.
biceps. So you start to compensate by straining this muscle. That's a very common with the golfer's elbow. It's fine. Relax it. Try it again, move it, and tell me how that feels.
See, it was real tight right there. Now it feels better.
It's gone or you still feel it?
Very little. I can feel very little now.
Where?
Right and around this area here.
Okay, let's drink more water. So it was 4 or 5, okay. Okay, try it again and tell me from 0 to 10 how much.
Magical water or what?
Yeah, well, yeah, it's not really. It's just releasing
Yeah, it's feeling-
the toxic, that's all.
Maybe just
Yeah.
it's feeling better. I don't know
Yeah.
what it is. What's going on here?
Okay. Alright, so we did the resistance and you were actually very weak and it went up to how much when we resisted before? 7 or something like that? 8?
Yeah.
Okay, so we're gonna do the same, I will do the same resistance, actually more.
Okay.
And you tell me how that feel. Okay, push my hand. See how? Stronger. 0 to 10?
Maybe 2, maybe?
Where?
Maybe 1. That's weird. Right in the same
Okay.
area. It's
Listen.
very little.
This is not magical water, okay? People are gonna go get more water out of this.
I don't know what's going on here.
It's just releasing the toxins. Okay,
I never drink this much water. It's pretty good.
okay, so let's try it again and push my hand and tell me how much you feel.
Yeah, I feel like maybe a 1
Where do you
2.
feel it?
Right here.
Right in there?
Yeah.
Okay. But you did not feel it without the resistance.
No, definitely.
Definitely stronger. You still need some work to do. Okay, so the new tool I have is actually work on decreasing inflammation. You might have a little bit localized inflammation. So I'm gonna work on that. So this is a special magnet that coated with anti-inflammatory coating. So I'm gonna use this just to make sure everything is, if you have a little bit of inflammation, to get it down. So I'm using one now because I'm assuming you don't have a lot of inflammation, okay? So if you feel better, so that's a really mild inflammation. If not, I'm gonna use 2 magnets and I'm just using this as a process of elimination to see how bad is your inflammation, okay?
Yes.
But with mild inflammation, a lot of patients actually one session with this, like for a few minutes, that should be enough. That's if you have a mild inflammation. And we're gonna see your strength after the. You said it's in here.
Yes.
Okay. Okay. drink enough water. Okay, let's move it around and tell me how that feels.
Okay, I don't feel it anymore.
Okay, let's do the resistance.
It's kind of weird.
What? Because you don't feel it?
Because I don't feel it.
How long have you been feeling it before? For a whole year?
About,
It was constant.
about 8 months, 9 months.
8 months, okay. Yeah, sometimes it's, you know,
Yeah.
push my hand. Okay, and tell me how you feel. You're really resisting now. You're resisting more.
Can I go play today? Just kidding. Yeah, that's
Next session we will play actually.
that's pretty good.
If you wanna play tomorrow,
Yeah,
but
very
you have,
little.
you have
Very
to
little.
come. You have to come here because I wanna see why you hurt yourself because it could be your swing.
Yeah.
You know, so I prefer to actually do it here and even tomorrow if you wanna do it
Yeah.
in the course, but I wanna evaluate your swinging.
Yeah, I know. With a lot of repetitive, ball hitting is what caused it because I never had this before. So
To be honest with you, seeing your posture like this,
yeah.
I want to make sure to correct your posture, especially your swing posture.
Yeah.
Because if you're sitting like this, I'm not sure, you might do the correct format, but you might have some restriction that actually compensating in your elbow. So that's what I want to correct.
Yeah.
So when you go swing, you don't injure yourself because you did the bad
Right.
motion. Does that make sense?
Yeah.
Okay. Resist again. And let's drink more water. Let's finish this.
That's the first.
Well, I got you another one, by the way.
That sounds good.
Yeah.
My wife's gonna be happy.
Okay, push and tell me how this feels. You're really resistant now.
Yeah.
Yeah. He's really applying a lot of resistance. The first time when I did it, you were not actually resisting.
Yeah.
You were just basically just move it. How this feels?
It feels a lot better. Definitely feels better. Yeah.
Yeah. You can turn around and tell me what do you think about the ASTR treatment.
Well, kind of like a miracle. Really happy with the results as far as this, not even a 20-minute session. I'm feeling great already. I look forward to it healing totally in the future. So
Yeah,
Yes,
awesome.
maybe-
Yeah.
maybe
Thank you
with the
so
next
much.
set. Thank you so much,
Thank
man.
you so
I'm
much.
really excited. Thank you.
Thank you. Yeah.
All right.
That's
Feel free to subscribe to my channel to get helpful tips on how to relieve pain and watch real treatment videos. There are over 45 studies that support ASTR treatment model. If you are a patient and would like to schedule an appointment or treat yourself at home, check the link below. If you are a healthcare provider and would like to receive ASTR training and buy ASTR instrument, check the link below. See you soon!